The origin of something great.
AHA, Advantage Health
When
Africa.
talking about AHA, you cannot avoid the origin story. Our origin started from a prompt. I went for a meeting where someone else in the ecosystem doing something different about performance invited me to come to an end of year strategy session. And each of the pharmacists presenting, I offered them that if they presented beautifully, I would offer them free consulting. And they presented excellently, and I offered it to 3 pharmacies. One of them, unbeknownst to me, was so popular. So when she put it out there on WhatsApp groups that, oh, she had met this Abimbola and she did this and this for her, it made us so popular. So I'm always grateful for that platform that was provided by Shina Opanubi and by Dr. Amaka Okafor. However, I had a lean team. So we started with my friend Michelle, Ayodeji, Olawale, and soon Morakinyo, Stephen, and eventually Shola joined us. These are people that I cannot thank enough for believing in the vision of Advantage Health Africa, for stepping forward beyond the rhetorics, and for doing what was needed to get us off the ground. Today, they're all still part of our story, and I'm mightily proud. When the story of AHA is written, I hope that they will be mentioned every time.
And for the last 9 years, Advantage Health Africa has added positive impact on the pharmaceutical sector in Africa, giving access to affordable medicine and quality care.
It gives you a sense of fulfillment, especially as regards accessibility. When you find out all the work you've done regarding demand generation, promotions, detailing, exhibitions, that comes to bear, and people can readily get your products in pharmacy, especially going to pharmacy maybe outside your comfort zones, like going as far as northern parts of the country. People can really get the product there. They can go on their own and ask for the product themselves.
Healthy partnership, in my own view, is the one that aligns with the mission and vision of Advantage Health Africa. Thinking of the human side, I remember a recent partnership that we signed on called NomaDoc. NomaDoc is a platform where travelers can include health package, health insurance in their travel package while they're coming into Nigeria. So we're trying to connect to the 30 December fiesta, and we had to quickly develop a package for those that are coming into Nigeria. We wanted to do a demo of what the package will look like. I remember NomaDoc trying to call our team in market access to ensure that we do the right package, the branding, the content, the right medicine inside the same package. We had to co-create that together, and that was such a beautiful experience. And it has been a partnership that we really have enjoyed so far.
Everyday healthcare, in my view, should be seamless. Shouldn't be injurious to someone who is already vulnerable, who is already ill. I recall a family member needed a colostomy bag, and typically he would get it from the UK. But in this particular season, he stayed longer in Lagos and couldn't get his regular supply. And I was so bold, I said, come on, let's go. I know pharmacies, and we went all the way to the island and we visited 9 pharmacies. 9, and none of them had a colostomy bag. It's such a simple device that I think shouldn't have been a hustle, but it was. And I wondered, here I am, a pharmacist. Imagine millions of other people who are not pharmacists, who have to go through such poor access to basic things that they need. And I thought I could do something about it. I was quite embarrassed. We eventually found it, and I imagined this situation like osmosis or diffusion, moving medication from a concentration point to a low concentration point. And that's what triggered us to start Advantage Health Africa's first flagship product, My Medicines.
The thing I've learned about access to medications and to healthcare system that most people do not know about is the fragmentation within the healthcare system. How a medicine can even be available at the next door, and the patient who needs it does not get it, right? And the way people access pharmacy and thinking that all they need will be available in the pharmacy is a wrong notion. Most time, pharmacies don't even have enough to stock all that the patient needs. And the risk of expiration is another thing that makes stocking limited in the pharmacy.
Okay, so because of the nature of our industry, one of the things that is very important for us to ensure that things work smoothly on the outside is that we are regulatory compliant. So that means that ensuring we find all the regulators that have in hand in the kind of things that we do, whether that's in data protection, in the core pharmacy itself, and things like that, and ensure that we get our licenses, our kite marks from them. After that is when we then start to translate our tasks, our priorities into standard operating procedures to ensure that team members across the organization know what they're supposed to do. Now, the reason why the standard operating procedures are important for us is that when one person is on leave or one person is unavoidably absent, we don't want our clients to notice that, oh, there's something going on, and maybe one person is absent or one person not available. So we have those standard operating procedures to support our work, to guide, and things like SOPs, payment policies, checklists, and all of that, just to ensure that on the outside, people don't see the amount of work that we have to do because we've covered all our bases.
And this is the story of Advantage Health Africa.